Hello, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that we see is magnified 30 or 40 times on the screen. And we're just now trying to clean up some of this inflammatory tissue and some of the torn rotator cuff tissue so we can see exactly what kind of tear we're working with. You've got a torn biceps here and a pretty significant amount of arthritis. Come back, let's see. Thanks. And so we will start by, look down, smoothing out the superior labrum here. And in this biceps, we're going to release because you can see how it's got all these splits. And it's really not a salvageable tendon at this point. All it's doing is causing pain. So we'll keep working and we'll show you some more in a little bit. Okay, so one of the things we're seeing here is you have a lot of arthritis in this joint. Hold the shaver, please. And you can see there's just been a loss of cartilage over large areas of the humeral head. See that? That's supposed to be nice and smooth, and it just looks very jagged and irregular. So part of what we're doing right now is trying to smooth out as many of these areas as we can, and also to make sure there's no loose pieces floating around in the joint. Pause. So we can see just a lot of damage to the joint here. You can see you've had probably an old dislocation in the past, and we've lost a lot of the socket part of the joint, and we've lost a lot of articular cartilage, which limits to a certain extent what we're able to do to try and repair the shoulder, because ultimately the only way to really repair this type of damage to the bone surfaces is with a joint replacement. But we've definitely decided to try and fix the rotator cuff. So that's what we're going to work on here today. Okay, pause. Pump off. I'll show you this large tear that we're dealing with. It's a big hole here in the rotator cuff. There really isn't a deeper layer to try and retrieve, I don't think. That's all part of the same layer of tendon. And what we're going to do first is place what we call a side-to-side stitch, starting back here. But first I want to make sure I'm getting back as far as I can. Here's a little, not really good tissue. Okay, so we'll get to work here. We'll use this hook and we'll pass it across just like that. We're going to do this in 2 bites, and so then we'll go ahead and feed the black wire that you see there. It's called the super shuttle. And we'll load that with a stitch and pull back. And we'll reach in here and get the again, and this time we'll bring the hook in from the front, which is the right side of the screen. And we'll see if our stitch goes about here. Okay, pause please. So we've passed all 3 sutures from the first anchor. You can kind of see how they're lined going off to the left. We'll reach in here and get this last blue and white striped suture. So we haven't tied any of them, as you can see, because to do that would close down the tear too much. It would be hard to place a second anchor, which is what we're getting set to do right here. I just wanted to show you we're about halfway done placing anchors, I think. That's a little bone fragment we're going to remove. Okay, so we'll keep working here. Pause. So now we've got a second anchor in, and we've got 3 more sutures passed. You can see there's 1, 2, 3 going underneath the tendon. And now the next thing we have to do is get all these sutures out anterior. So we'll gather them all up like this. And then we'll get the 3 sutures from the first anchor, which are parked right here. Okay, and now we've got all the sutures coming out on the right side of the screen. And we're going to start from the left and tie them one at a time. So we're going to start with this one. And we will show you how we tie these knots here. See how that brings it down. So we'll finish this knot and show you some more in just a minute. Okay, so we've tied all 3 sutures from the first anchor. We just wanted to show you. Oh, sorry. Just wanted to show you here. Let me rotate this a little bit. Okay, and now we're getting ready to work on the sutures from the second anchor. So we'll get these tied and show you what it looks like when we're finished. Get them out. Okay, we're all finished here. We've got everything repaired back to the bone, and it actually looks pretty good. This is only battle, though. We know that we have to give this a chance to heal, and that with all the other injuries you've got, we've got to be real patient with it to see how much we can get to heal. So we're going to be finishing up here and getting you back to the recovery room in just a few minutes, okay? Good luck to you now. Bye-bye.